We all want what's best for those we love. And when it comes to finding medical care for our children, then more than ever, we want the very best. If your child has an orthopedic condition or injury, then the very best is Shriners Hospitals for Children Spokane, where we have been providing comprehensive care for children with conditions of the bones, muscles, and joints since 1924. The hospital in Spokane is part of the one-of-a-kind Shriners Hospitals for Children healthcare system, with 22 hospitals in the U.S., Canada, and Mexico dedicated to improving the lives of children through pediatric specialty care, innovative research, and outstanding teaching programs. Shriners Hospitals for Children have been providing state-of-the-art care since 1922. That was when the Shriners International Fraternity opened its first pediatric orthopedic hospital in Shreveport. Today, more than 100,000 children receive expert family-centered care for orthopedic conditions, burns, spinal cord injuries, and cleft lip and palate. Any child from birth to 18 years is eligible for admission to a Shriners Hospital if there is a reasonable possibility they could benefit from our services. And there's never a charge to patients or their families. And while all services are provided at no charge, don't mistake them for being anything less than exceptional quality.
From the very beginning in 1924, it's always been about delivering the highest quality care that's available. It's all here, it's all brought to the child in a family-centered, focused way. That's what makes us unique and different than any other pediatric hospital. Nothing's changed in all those years.
Our mission at the Shrine Hospital in Spokane is to provide the best pediatric orthopedic care possible. We are fellowship trained in children's orthopedics, and so we have extra training in treating club feet, dislocated hips, scoliosis surgery. A lot of the orthopedic problems that are more complex get sent here.
We see patients from all over Washington, Montana, northern Idaho, Alaska, western Canada, and even Mexico here at Shriners Hospital for Children in Spokane.
We've seen children here from Sierra Leone, Africa. We've seen children here from Albania. They are enveloped in our unique care delivery until they're ready to go home.
Several times a year, we send a team to visit clinics for children in Mexico to identify kids who might benefit from our medical expertise. Many of these families come to Spokane to be treated, and once they have returned home, our medical staff follows their progress at each visit. Every day, physicians, nurses, therapists, clinicians, and technicians share information and ideas so everyone understands what has to be done to ensure the best possible outcomes and help our kids defy the odds. The medical staff at the Spokane Shriners Hospital includes several full-time orthopedic surgeons, a pediatrician, and more than a dozen other consulting physicians who regularly partner with us from the community.
We practice a level of medicine that's state-of-the-art. Our facilities and our capabilities are state-of-the-art.
Dr. Baird has been nationally recognized as a Ponseti-trained physician for the treatment of clubfoot, using massage and casting.
Casting treatment of club feet is a very, very good thing, because what it allows to occur is that the foot can be realigned in a natural way.
When surgery is necessary, our specialty-trained orthopedic surgeons and staff are experts at treating children.
50% of our cases are same-day surgery cases. When we do have patients that need to stay, our average length of stay is about 3 days. Fortunately, we have the ability to keep our same-day surgeries longer if they still need another night in the hospital for comfort or for family needs.
Our interdisciplinary approach to care starts with family, putting parents and patients at the heart of the team. Fully involved in decision-making sets us apart from other healthcare facilities.
We're a family-centered hospital, so we like to do what's best for our patient and our families. We allow the parent or the guardian to stay in the room overnight with the child as long as they're here. They have a family center. It has 6 rooms. It can accommodate definitely more than one person, so even if siblings come, they can stay at our family center. And we also have room service so that the children can pick foods that they're comfortable with and used to and that they like.
One thing that we had never experienced anywhere else is the comfort that they made for the entire family. It wasn't just the patient. Our child that wasn't having the surgery was just as included. And then it makes it way more enjoyable for the parents, you know, for our nerves and what we're having to discuss and think about.
Having my family stay with me is very nice because I don't like being alone and I like the support and the comfort.
The rehabilitation staff at the Spokane Shriners Hospital work hard with patients to help them achieve their full potential.
So I feel like because of the therapy, maybe they've got to where they can walk now, or we've gotten them the equipment they need. It can be, you know, getting them a wheelchair or a power wheelchair, and now they are able to be more independent.
Both physical and occupational therapists provide assistance with daily living, rehabilitation after surgery, proper equipment design and fitting, use of prosthesis and orthotics, and preparation for successful follow-up at home. And the nutrition services staff and dietitians help to make sure that the children learn good eating habits and choices for lifelong health.
One of the things about Shriners that I found really different from some of the other hospitals that I had been to is that the people here at this hospital were invested in my success, and I think that perspective has been really valuable to me as a therapist. I can share my experiences with families. It's a great opportunity to work with people who have so much courage. Kids come in here and they have painful surgery and they meet every day with a smile.
The staff at the Spokane Shriners Hospital is dedicated to more than just addressing physical needs. We are concerned with the health and well-being of the whole child. Surgery and rehabilitation can be difficult, and the hospital staff never loses sight of the fact that we are serving children, so we strive to make things easier and more fun.
Pet therapy is one of our most popular programs at Shriners in our recreational therapy program, and it has really a lot of benefits for kids. It's been proven to lower heart rates and lower blood pressure for kids, so that's really helpful for pain management. Also, there's a lot of emotional and psychological benefits as well. If kids can stay relaxed, especially after surgery, they're going to hurt less. And if they hurt less, they're going to heal faster and go home faster.
Before a surgery, we will take them on a tour of the surgery area, the pre-op area, and this helps them take away some of the mystery of what's going to be happening. We show them equipment such as an anesthesia mask or IV, show them how it works, let them play with it. It can help calm a lot of fears.
A care coordinator assists every family through their entire experience with Shriners and makes sure each parent and child is taken care of.
When families first come to Spokane Shriners Hospital, we go over an assessment package and we look at all the needs of the child. I think it is difficult for these families. They oftentimes don't have all the knowledge, they don't have all the skills. It's brand new to them. They're scared. They need a support place.
They're able to give you answers and educate you on what's going on and why things are happening this way, and that's a big help.
We don't just stop at addressing the medical condition. We do everything within our power to reconnect our kids to the home and school environments to which they'll be returning. For older teens, our Transitions program helps them evaluate their options for care outside the Shriners Hospital system. As our patients grow, we can help them see how they can be successful as adults.
There's a transition camp for older teenagers where you get to go away for a week without your parents. And you can do things like resume writing and job interviews to help prepare you for college.
They brought the panel in of kids that have been through everything from the surgeries and now are grown adults, and they could talk to them and tell them, you know, here's what you expect, here's what you got to do.
Through events such as our Come Out and Play Day, Kids Day at the Park, and other community events, we are able to help educate Spokane's families on raising and caring for healthy and active children. It's these kinds of support services that round out our reputation for excellence and for getting results. But what may not be as visible is how much better the care is at Shriners Hospitals thanks to the research we conduct throughout our hospital system. Every year, the Shriners Hospital's healthcare system spends tens of millions of dollars on research, resulting in more Shriners Hospital's kids having a chance to live healthier, fuller, more productive lives. The application of the detailed research data that we obtain from our state-of-the-art motion analysis lab is just one example of our research involvement here in Spokane.
Here in the motion analysis laboratory, we see kids with walking difficulties or walking disorders, and we're about trying to capture data on their motion. So we do that with three-dimensional computer reconstructions. In terms of research, we're able to look at before their treatment and after it and see what's changed, and we can do that in a precise quantitative manner to really look at what treatments are working best for certain problems that we see.
Studies looking at treatments for cerebral palsy, clubfoot, knee and hip surgery, and others have led to refining our techniques to provide even better care and treatment for our patients. We're also proud of our role in medical education. Over the past 20 years, more than 8,000 doctors have completed medical residency or fellowships in the Shriners Hospital's healthcare system. In Spokane, we sponsor seminars, continuing medical education training, and outreach conference presentations. We also provide training for students of nursing, therapy, social services, and radiology, and routinely share the findings of our research with the pediatric medical community at large. In the final analysis, we are about providing extraordinary, loving medical care, and the family's relationship to a Shriner, their financial situation, or their insurance coverage simply doesn't matter.
The great thing about our system is that we do not bill or collect insurance for the care we deliver here.
Not having to be dictated by an insurance company or a family's financial well-being frees us up to do what's best for the child. We can treat the kids as we see fit with pretty much no restrictions.
All the funding for Shriners hospitals comes from the generosity of Shriners themselves, individual donations and gifts, and through corporate giving.
Local Shriners across the communities we serve also work to sponsor charitable events to help fund our hospital, such as the annual duck race held each fall in Spokane. Thousands of toy ducks chase down the river to help raise money and donations for the hospital and increase awareness of our mission of helping kids. Many of our patients have to travel great distances to get to our hospital. And so, to provide assistance with these trips to and from their appointments, many local Shriner groups are able to provide transportation from the patient's community. When a physician refers a family to Shriners Hospitals for Children Spokane, or a family chooses to come visit us on their own, we want the process to be simple.
We just went to our regular doctor before and he sent us here, and it's just been an easy experience, very nice.
Just call us, talk to a member of our team, and learn how we can help your child.
The Shriners International Fraternity is an organization dedicated to fun, fellowship, and helping children. With their distinctive red fezzes, they bring smiles and laughter into their communities and to the children at the hospitals, and so much more. If you know a child who could benefit from the one-of-a-kind medical expertise, care, and compassion we provide, please call us today, because every child deserves the very best there is. Shriners Hospitals for Children Spokane.
We're just really thankful, and we just really appreciate Shriners and everything that they've done for us.
Gracias, Shriners.
Thank you, Shriners.